My name is Amanda Xavier, and I am a clinical psychologist and digital health coach at Naluri. I'm excited to share about today's topic, which is all about therapy. And hopefully, by the end of this, you would know a lot more about therapy and perhaps be inclined to try it out for yourself. I'm sure you have heard of the term therapy before this, but if we were to look at where this word came from, there's a lot of history to dig through. Even before the written language, people told stories and parables. It's an ancient tradition that often served as a kind of therapy, helping people heal while passing on wisdom to support others. More than 3,500 years ago, references to this appeared in ancient Egyptian and Greek writings. So it's been around for much longer than we think, although the history of psychology and medical science took over to bring us the current understanding of therapy. The more formal term, psychotherapy, was coined in the late 1800s with the definition of a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. It's during psychotherapy where participants examine their moods, feelings, thoughts, and behaviors while learning how to take control and respond to challenging situations in a healthy way. Now, psychotherapy, also known as talk therapy or just therapy, is a form of treatment aimed at relieving emotional distress and mental health problems. Therapy involves examining and gaining insight into life choices and difficulties faced by individuals, couples, or even families. Therapy sessions refer to structured meetings between a licensed provider and a client with a goal of improving some aspect of their life. The most critical part of this is that the client or patient works collaboratively with the therapist in order to make improvement and positive change over time. Therapy can be provided by mental health service providers, which include psychiatrists, psychologists, and counselors. Some of these words are used interchangeably, but there are differences between each profession. Psychiatrists are trained as medical doctors who specialize in psychiatry to provide pharmaceutical intervention for patients struggling with severe mental disorders such as schizophrenia, clinical depression and anxiety, OCD, and neurodevelopmental disorders, to name a few. They are able to prescribe medication to their patients, and some are also certified in providing psychotherapy or talk therapy, but not all choose to do this. Psychologists or clinical psychologists are trained in clinical interventions to address moderate to severe mental disorders through psychotherapy, such as cognitive behavioral therapy and much more. In some countries, clinical psychologists study until a doctorate level and have the doctor title, and in some other countries, we receive the full training through a master's program without a title. However, both are qualified to provide evidence-based intervention in therapy to a variety of emotional distress and mental health disorders. Counselors are trained in talk therapy to provide interventions for addressing mild to moderate issues, and they are licensed to do so. Counselors complete a master's program in counseling and go on to be licensed for practice. They can help with more difficult issues also, but the main difference is that they are unable to do psychological assessments for diagnosing and reporting purposes, unlike clinical psychologists and psychiatrists. Therapist is a term that can be used for any of the three professions as a layman term, but there also exist therapists who are certified in specific types of therapy, such as applied behavioral analysis therapy, commonly used for helping clients with autism, or music, drama, art, and dance therapy as well. Therapy in general is for understanding and managing issues that you face, be it those at a clinical severity or issues that make your life overwhelming but doesn't require a diagnosis. It could range from relationship problems and work stress all the way to major mood disorders, addiction, and personality disorders. It can be used as an intervention tool to help get your life back on track by teaching helpful coping skills. Or it could also be used as a prevention tool to help you make sense of your difficulties and concerns before it evolves into something more severe. For a lot of people, therapy is a place where you can safely share about your worries and difficulties without judgment and be given the support and validation while working on managing these issues. But despite all of the lovely reasons for therapy, there still exists a lot of misconceptions and taboo around therapy, especially in more conservative countries that are not ready to address mental health nationwide. Many still believe that therapy or any psychological intervention proves that one is crazy, or that mental disorders are contagious, or the people that have mental disorders are violent and irresponsible. Because of this, many are keen to avoid being seen to need therapy or psychological support. However, this pushes many people further away from receiving the help they need, which makes it even more difficult for them to manage their symptoms and behaviors later on. In contrast to the misconceptions about it, therapy really is for anyone and everyone, even if you are not labeled with a mental disorder diagnosis. A lot of us need a bit of extra support from time to time because we weren't meant to figure things out perfectly alone. Even your own therapist would be attending therapy for themselves to help unload the emotional fatigue that they experience in their work. I myself have been going for regular therapy sessions since beginning my career as a clinical psychologist to avoid severe burnout. So, what actually happens in therapy? If you have a concern that is clinically significant, which means that it is affecting your life to the point of having difficulty functioning normally, the approaches in therapy would help you to manage and resolve these symptoms so you can have a fulfilling life. As there are many different therapy approaches, I will only touch briefly on the common ones that are evidence-based and used more. Even if you don't have a clinical concern, therapy and counseling can still help you to learn coping skills and resolve any issues you may be struggling with through the approaches discussed. Despite all the differences between the therapy approaches I'm going to talk about, most, if not all, therapy approaches start out with establishing a therapeutic goal, which can be anything from improving self-confidence and communication skills to reducing symptoms and managing triggers in the future. The approaches are then structured to help you achieve this goal through their various techniques. One of the most common and well-known therapy approaches, also known as the gold standard of therapy, is cognitive behavioral therapy, or CBT for short. CBT is based on the theory that the way we think and perceive our experiences greatly affect how we feel and what we choose to do. For example, if we believe that we are not good enough, we would feel anxious and fearful when asked to present a speech in front of our team, and make excuses to avoid this task. CBT helps you to understand your own negative and unhelpful thoughts and beliefs, gives you the techniques to challenge and overcome these, and introduces healthier thoughts and beliefs that get you to your therapy goals. CBT is also widely used for almost any concern and mental disorder. Another common approach is known as acceptance and commitment-based therapy, which branched out from CBT. It's known as ACT or ACT for short. It has a similar theory of thoughts and perspectives affecting your emotions and behaviors, but ACT helps you to accept the challenges you face and learn to move forward with your life, holding those difficulties that you have. This is commonly used for grief and loss, but is also widely used for a variety of mental disorders as well, such as anxiety, depression, trauma, and many more. An approach that you may see more of in movies and TV shows with someone who lies down in the couch and the therapist is asking about their life is called psychodynamic therapy. This comes from the earlier days of psychotherapy, where exploring one's childhood experiences helps to give answers to one's difficulties in adulthood. There are many techniques involved, such as finding repressed memories and experiences, uncovering defense mechanisms, and many more. But the overall goal is to help people gain insight into their lives and present-day problems. They also evaluate patterns people develop over time. Recognizing our recurring patterns can help people understand how they avoid distress or develop defense mechanisms to cope. This insight may allow them to begin changing those patterns. Some other approaches that I won't go into detail are the Rogerian, humanistic, behavioral, or compassion-focused therapy approaches. There are many approaches that come from years and years of research on therapy and how to best provide support that helps individuals to achieve their goals. Now that you know what therapy is, how do you know if you should try it? At the end of the day, remember that therapy is for any reason you need it. Therapy is one of the very few spaces where there is no judgment or biases, and you can express yourself fully to a professional who is trained to give you the help and support you need. For many, therapy is a part of their self-care, as they invest their time and money into a service that helps them grow more and more each time. You can go for any reason, Be it if you have mental disorders or symptoms of mental health disorders, struggling with relationships or friendships, wondering about your purpose and meaning in life, needing advice from an objective, non judgmental person, or even just to have someone who listens fully and supports you. You can think about therapy the same as you would visiting a doctor for ailments such as a mild flu or a serious medical condition like a stroke. A flu doesn't greatly affect your functioning like daily life stresses, but you can still seek help to manage it. A stroke does affect your ability to function normally and healthily, something like schizophrenia or severe depression, and it's all the more reason to seek professional help. You can start therapy even if you feel like your concerns are too small, because if it concerns you, it's definitely worth addressing. I hope that this sharing helped give you some insight into what therapy is and may have sparked your interest to try it yourself. Thank you for listening.